So my name is Carol Smith. I'm the Gynaecology Clinical Nurse Specialist for Walsall Manor Hospital, and I've been asked to speak to you today regarding ovarian cancer. So I'll be looking at what is ovarian cancer, what are the signs and symptoms and the risks for this disease. So first of all, I'd like to give you some facts and figures about ovarian cancer. Unfortunately, more than 7,000 women are diagnosed each year in the UK with this disease. I've looked at the figures for Walsall. There were 20 in 2020 and 24 in Walsall in 2021. More than 4,000 women die each year, which equates to 11 women every day in the UK. There are 41,000 women living with ovarian cancer in the UK. If you're diagnosed at the early stage, stage 1, 9 out of 10 will survive. But 2/3 of women are diagnosed late when the cancer is more difficult to treat. Unfortunately, half of GPs believe that symptoms only present in the later stages of the disease, and this is incorrect. More than a quarter of women are diagnosed through emergency presentation at A&E, which means they've lived with their symptoms for a long time before the symptoms become unmanageable, and then they present at A&E in an emergency situation. And this is very important. 1 in 5 women believe a smear test would detect ovarian cancer, which is untrue. So, what is ovarian cancer? It's a cancer that is what it says on the tin. It develops in the ovaries and then spreads to other parts of the body. The symptoms are persistent and they include things like bloating, not bloating that comes and goes, bloating that stays with you and is frequent, more than 12 times in a month, for example. The other symptoms are feeling full very quickly and a loss of appetite. Some women can experience pelvic and abdominal pain. Some women have some urinary symptoms, perhaps needing to pass urine more urgently and more often than usual. There are some other occasional symptoms, the main ones being a change in your bowel habit. Suddenly you become to be more constipated, or you have more diarrhoea, and this is different for you. You can experience extreme fatigue and some unexplained weight loss. And also one of the rare symptoms is some bleeding after the menopause. Now previously, in the past, the term the silent killer was used for ovarian cancer, and recent NICE guidelines have advocated that we don't use this symptom anymore. In order to increase early diagnosis, we need to challenge this myth that the symptoms of ovarian cancer can't be spotted until the later stages of disease. Women with early stage of ovarian cancer do have symptoms, and we need to listen to them and investigate these symptoms and diagnose early so that the treatment can be successful. Unfortunately, there's currently no screening test for ovarian cancer, and a women's route to their diagnosis is key to their survival. Going on to look at the risks of ovarian cancer, the 2 greatest risks are age and family history. The risk increases steeply from the age of 45, and the greatest risk is women aged over 75. Most cases occur in women who have already gone through the menopause, but 1,000 young women also develop ovarian cancer each year, and all women should know the symptoms. Over 1,000 women develop ovarian cancer because they've inherited a faulty gene mutation, and this can come from either their mother's or their father's side of the family. These are the BRCA1 and BRCA2 genes that are also linked to breast cancer. There are other 2 side effects, being overweight and smoking. And then a small number of women, around 4%, their cancer is diagnosed and linked to the use of HRT or hormone replacement therapy. This is a small risk, and women should discuss with their GPs the merits and the risks of taking HRT, as it is a very useful tool to help with the symptoms of the menopause. So I think what I really want to say to all women in Walsall and the surrounding area is if you have any symptoms that are causing you concern, then seek medical advice as soon as you can. Early diagnosis means early treatment, and that means that there will be more women that survive this cancer. Thank you.